Dr. Linda Niessen, the Dean of KCU College of Dental Medicine. Good morning to you.
Good morning. It's
so
a pleasure to be here.
We're so glad to have you here. We're talking about options for replacing missed or lost teeth this morning.
That's right.
And there's a lot of options.
There's a lot of options. You have what we call fixed solutions, where they stay in the mouth, and then removable solutions where you take them in and out of the mouth.
Okay, so let's talk about it. And you brought some really cool demonstrations to show us.
Models, yes. Because we got to educate patients. You know, we want to make sure patients understand what their choices are. So the kind of most traditional way of replacing one missing tooth was a bridge. Okay. And this is what you see here. You see the bridge here, here's the missing tooth, and then you have the two teeth on either side that are called abutments. We call those abutments because they span, and then this is the missing tooth that spans the missing space. Okay? Sure. So that's kind of the most traditional method that we've had.
And that's a bridge.
That's called a bridge. Okay. That's a fixed bridge. Okay. Then we have an implant. If you don't want the bridge, because what you have to do is cut down, prepare these two teeth for crowns. So you may take healthy teeth and cut them down. So sometimes people don't want to do that. So here's the implant, and the implant essentially is two parts. It's the root of the tooth. It's the screw that goes in first. It goes into the bone. It's a surgical procedure. You have to let it sit for, maybe 3 to 6 months, and then you put the crown on top. So the crown goes on top of it.
On the post?
On the post, which is called the root, right? And then assume these were just healthy teeth that you didn't have to make a crown
have anything
so they could just be healthy and left alone. So that would be your implant solution. If you lose all of your teeth, you may need a denture. And the denture is removable. The denture comes in and out. And this is a top denture. The top denture, you can see, has the palate to help hold it in. Yeah, you see it
to
here.
The top. Yeah, for sure.
And then the lower denture, you can see, has space in the middle. That's where your tongue is. So it doesn't have as much to hold on to. So sometimes we put implants in. And you can see the two implants here. Yeah. And then the denture goes on top, and it helps hold it in, so it retains it a little stronger.
Those two little things, those two little
metal things that you see.
Those
really implants
hold the bottom one in, especially like you said, the lower one.
The lower one
is
always harder to hold in.
The good news is you all are accepting patients right now, and new patients.
Yes,
your students are seeing patients.
Our students are seeing patients. Our students now have gotten to the point where they're seeing patients, so we are accepting new patients. Excuse me. We would love to, if anyone doesn't have a dental home, we would love to welcome them to our dental home at the Kansas City University College of Dental Medicine.
And you can call to set up an appointment. The number is there on your screen. It's 417-208-0806.
That's right.
Accepting new patients.
We are accepting new patients.
So even if you don't need any of this stuff and you just are like, I just need a teeth cleaning, or I just need to make sure my teeth are healthy, or x-rays or whatever.
Or I need a filling, come on by.
Alrighty, Dr. Niessen, thank you so much. We so appreciate you being here this morning.
My pleasure. Thank you.